And today, the doctor is in. The topic
like
is dementia. It is a common thing that we hear in terms of dementia and Alzheimer's. It's used interchangeably, but there is a difference. So Dr. Scott Ackerman, one of the First Coast's leading doctors, is here today to discuss the differences between the two. So I thought it was really just one and the same, dementia and Alzheimer's, but that's not really the case.
So dementia is a symptom, and Alzheimer's is a disease. So there's a difference between dementia and Alzheimer's. Dementia means that something's wrong with a person's brain. But having dementia doesn't give insight as to what's causing this cognitive difficulty. Alzheimer's is one disease that can cause dementia, but there's other diseases that can cause dementia as well.
Okay, well, that's interesting, because I had always thought it was just one and the same, and you know that if you have dementia, then you have Alzheimer's. But again, that's not necessarily how it is. Okay, so what are some of the symptoms then of dementia that people need to be on the lookout for?
So dementia is defined as memory loss, impaired judgment, difficulty getting verbalizing things, language difficulty, disorientation, difficulty planning. People that are demented frequently neglect their personal care and their safety. A person who has dementia will repeatedly ask the same question because he or she doesn't realize they got the answer already. They may become lost in familiar places, or maybe not even recognize familiar people.
And this goes beyond just like forgetting where I put my keys or why did I walk in the room. I mean, takes it to a whole new level, I would assume.
Well, you know, it could start out by someone who forgets where they put their keys or forgets why they walked in the room. This could be early signs, but if they progress, then there's something a little bit more serious.
And what are the common causes then of dementia?
So there are progressive medical conditions that attack the brain cells. Alzheimer's, as you mentioned earlier, is one of them, where it attacks the brain cells and someone gets progressive dementia. Parkinson's disease can cause dementia. Huntington's chorea, these are neurological problems. Alzheimer's accounts for about 70% of cases of dementia. But other things besides progressive neurological diseases that can cause dementia are things like a stroke. If you have a small stroke, which is the disruption of oxygen flow to the brain through a clot or a spasm of an artery in the brain, that will cause dementia. It matters where in the brain that stroke happens. Someone who has poor nutrition or is dehydrated, you know, a runner who gets dehydrated, they'll have dementia at that time when they're dehydrated. Someone who has a drug abuse problem or alcohol abuse problem, those are causes of dementia as well. I see patients with brain tumors, and many of them present with dementia. I've had a number of patients get lost on their way home, and their spouse takes them to the emergency room, and only to find out that they have a brain tumor.
Wow.
A trauma to the brain can also cause dementia.
Yeah. So how can dementia be prevented or delayed? Is there anything that we can do at home now?
Well, yes.
Yeah.
So certain causes of dementia can be reversed. If it's a nutritional deficiency that's causing dementia, you can reverse that by correcting that. If it's a brain tumor that's in the brain causing pressure, that's causing dementia, if the brain tumor is removed, sometimes that could eliminate the dementia. If it's alcohol or drug abuse, then you stop doing that, and you get reversal of dementia. Not always complete reversal, though. But research has also shown that good health habits and good mental stimulation may prevent or delay the onset of just natural dementia, or may delay the onset of Alzheimer's or those sort of diseases that cause dementia. So exercise, eating brain-healthy foods like avocados and salmon and blueberries, doing things to prevent yourself from having a stroke by lowering your blood pressure. Make sure your blood pressure medications, lower salt from your diet, cholesterol, those sort of things to help prevent from getting a stroke will help prevent you from becoming demented. Minimize stress in your life. Get good sleep. That'll keep your brain alert and awake. And as I mentioned earlier, some studies have shown that if you challenge your mind by engaging in intellectually stimulating activities such as chess or Sudoku or crossword puzzles, those sort of things will help slow down the progression to dementia. It's normal in all of us as we get older for us to have some mental speed that slows with age. Our blood vessels in our brain aren't as elastic as they are when they were young, and so blood and oxygen doesn't flow to the brain quite as well. And so these exercises may help compensate for that. And most of the time, the slow progression is not that much cause for concern. It's just part of the aging process. But if you have a rapid memory loss, this is a cause for concern, and this is something where you should see a physician and find out what the etiology of it is.
All right. Thank you so much, Dr. Ackerman.
Thank
As
you,
always,
Casey.
appreciate you being here, sponsoring this segment. And Dr. Ackerman, he joins us every Friday right here on First Coast Living for questions regarding today's topic or any other health questions that you might have. All you have to do is visit firstcoastoncology.com, confidentially submit your questions to Ask the Doctor.